Good afternoon. My name is Lucy Azobi. I'm doing this presentation on depression, and my title is Implementation of the Patient Health Questionnaire 9, that's PHQ 9, in a mental health outpatient clinic. Good afternoon, class. Good afternoon to my chair, Dr. Moya Aislinn. Thank you so much for listening to my presentation. Before I continue with this presentation, I will give a little bit of background about depression. Depression is one of the most common mental health disorders in the United States. Depression, in other words, known as major depression, can impair the way people function and think and affect their ability to carry out their activities of daily living. People with depression might experience overwhelming feelings of sadness, hopelessness, or emptiness, and physical symptoms like changes in appetite, sleep disturbances, and fatigue can accompany these feelings. Also, some people with depression could start having suicidal thoughts. It is a complex condition that often requires treatment and support. The National Institute of Mental Health states that in 2021, an estimated 14.5 million U.S. adults aged 18 or older had at least one major depressive episode with severe impairment in the past year. Additionally, 700,000 people die from suicide annually, and it is the fourth leading cause of death in the age bracket of 15 to 29 years. According to the American Family Physician, the United States Preventive Task Force recommends screening for major depression in the general adult population and the importance of having a sound system to ensure a proper assessment, diagnosis, treatment, and follow-up. The problem in this mental health outpatient clinic was a gap in practice, which was a lack of knowledge among psychiatric mental health nurse practitioners in using the PHQ-9 screening tool frequently when assessing depression. Therefore, educating the psychiatric mental health nurse practitioners on the importance of using the PHQ-9 screening tool frequently in an outpatient clinic was crucial. In that regard, it was necessary to implement the frequent use of the PHQ-9 screening tool through education. The tool, which is a multi-purpose tool for screening, diagnosing, and monitoring the severity of depression over time in the outpatient mental health clinic. Hence, the purpose of this study was to determine if an educational intervention to educate PMHNPs on the frequent use of the PHQ-9 screening tool would increase the use of the tool in daily clinical practice and improve patient outcomes. Other authors like Solima in 2024 carried out a similar study to support the essentiality of educational intervention, stating that a quality improvement to boost practitioners' knowledge about the frequent use of the PHQ-9 screening tool instead of the PHQ-2 was important. In this study, the findings showed that the intervention led to increased knowledge and an increase in the intent to apply the PHQ-9 screening tool. With 2 participants, he showed that the intervention positively impacted the use of the tool. Another author, guided by the Iowa model of evidence-based practice, designed and implemented an educational intervention aiming to educate healthcare practitioners on managing depression. The study, just like the study that I'm carrying on, was done in an outpatient psychiatric clinic. In 2019, another author named Daramola applied the Plan, Do, Study, Act cycle to boost the practitioner's knowledge concerning the use of the PHQ-2 and PHQ-9 screening instrument for depression by 50%. The educational workshop led to a 15% improvement in knowledge and awareness concerning the PHQ-9 screening tool. The research had 8 participants undertaking the training sessions, with 6 of them being medical assistants and 2 primary care practitioners. The Plan, Do, Study, Act cycle is the framework that guided this project. The plan aspect of the framework encompassed determining the need for an intervention to boost screening and creating the necessary materials for the intervention. The do stage was the intervention that involved close collaboration with the PMHNPs and the institution's management. The study element involved assessing the data to determine the impact of the intervention, and the act included the recommendations and implications for further practice. This structure ensured a thorough approach that offered insight on boosting depression screening, and thus improving healthcare provision. The design was a quantitative data design. The data collection was a pre- and post-chart review. The study involved 19 PMHNPs who voluntarily agreed to participate by signing the voluntary disclosure consent at the mental health outpatient clinic to participate in the educational training to gain knowledge on the frequent use of the tool. Participants were identified using codes during the pre- and post-interventions, including demographic information such as gender, age, and professional experience. However, the author gathered the minimal information necessary to achieve the project goals. Any information deemed unnecessary or irrelevant to the study was excluded from the data collection instruments. The variables measured were found to be retrievable in the facility's electronic medical records. The study observed the necessary ethical guidelines and policies to protect the researcher's integrity and participants' privacy. The sample encompassed 20 healthcare practitioners who were made up mostly of females. The participant had a master's degree and the remainder had a doctoral degree. The ethnic background of the sample included 60% of African Americans, 25% were Caucasians, 10% were made up of Hispanic, and 5% were unknown. The data analysis of the project was descriptive statistics that were used to examine the participants' group's characteristics. The mean, the standard deviation, and frequency gave the basic patterns of the PH29 screening tool usage rates and the changes after the intervention. The statistical analysis used a z-test for the difference of two proportions to compare the results of the pre- and post-intervention changes. Given the nature of the data, the test was the most appropriate in determining whether the mean change due to the quality improvement was statistically significant. The sample size remained the same across the assessment, ensuring no missing data values and thus consistency in measurements. Data analysis showed a significant increase in the frequency of the PH29 screening tool use. Pre-intervention, the usage rate was 19%, which increased to 86% after the intervention. This means that the intervention was successful and it had a substantial impact on the practitioner's practice. The intervention made screening and diagnosis using the tool more common and a part of daily routine. The standard deviation of PH29 was 0.911 before the intervention and 0.612 after the intervention, as seen on Table 1. Despite the rigorous methodology, the study had some weaknesses, a major one being the relatively small sample of 20 practitioners reduced to 19 after the intervention. Although the results concerning the use of an educational intervention collaborate with most of the literature on the same, the small sample is not a conclusive reflection of the vast pool of PMHNPs in the health sector. Other researchers can look at larger samples to contribute more generalizable results. Also, while the data for the PH29 screening tool use rate was from the AMRO system, the practitioners may put it there as a form of self-reported data, so inherently it might be subject to self-reporting bias. Some practitioners might report using it when they did not in fear of the repercussions, and others might forget to note that they use a screening tool in their practice. The successful implementation of these quality improvement interventions to increase the use of the PH29 screening tool instrument in an outpatient mental health facility has provided various insights that can help boost healthcare provision, thereby improving patients' outcomes. The study showed that educational interventions are effective in boosting knowledge and effective practice among practitioners. The increased use of the PH29 tool for screening, diagnosis, and treatment of depression meant an increased consistency in depression screening. This is evident from the reduced standard deviation post-intervention compared to pre-intervention. Hence, the project standardized care provision, ensuring the practitioners accurately diagnose patients with depression effectively. The versatility of the teaching methodologies was vital in the project's success, as they gave the PMHNPs a variety of methods they could choose from to learn the intended lessons. This further accommodated the different learning preferences of many people, boosting the approach effectiveness. Various improvements could be made to this quality improvement project going forward. For instance, it is crucial to see how the educational intervention fares across different healthcare facilities in different regions. Thus, the results can be compared to develop universally applicable strategies. Larger samples of participants could also give new perspectives on the efficiency of the approach when dealing with many people. The result of this study have significant implications for PMHNPs. Showing such a large increase in the use of the tool, the study acts as a guideline that can help institutions increase the knowledge of their practitioners and eventually patient outcomes. The project highlights the essentiality of utilizing a standardized tool, in this case, the PHQ-9 screening tool, which ensures more accurate depression screening. Healthcare facilities should ensure that their practice encompasses tools that have been used to be beneficial for the patient to ensure more seamless operations and the best care. The study also underlines the importance of educational interventions in boosting professional development through constant training courses. Interactive sessions that allow the practitioners to ask questions and seek clarification are the best at improving knowledge. In addition, the courses should also be accompanied by strategies to minimize challenges the practitioners might face in learning and applying the tool. For instance, adjusting work schedules could allow more practitioners to attend educational seminars. Policies from the institutional level to the national level can be set up to increase the use of the PHQ-9 screening tool and advance the screening, diagnosis, and treatment of depression. One way of ensuring that facilities consistently apply the tool is making it mandatory to use the tool when dealing with patients with depression. There is also a need to set aside funds to aid in setting up seminars and relevant workshops for re-educating the practitioners. This will facilitate continuous education. Moreover, policies should ensure enough civic education for the public to understand the benefit of partaking in the PHQ-9 screening tool. This will ensure there are willing participants, further streamlining the implementation of the initiative. The patient education campaigns can be done on various platforms so as to reach as many people as possible, including media, advertisement, social media, and community gatherings. From this research, it is evident that healthcare facilities should use PHQ-9 screening tools for detecting depression, as this can increase timely diagnosis and improve healthcare outcomes. This study shows that educational interventions can be highly effective. Thus, institutions should invest in consistent education efforts to ensure healthcare practitioners are providing the best care. Also, follow-up assessment over a long period of time could give insight concerning the sustainability of changes and how to effectively maintain them. Thank you very much. Are there any questions? Any questions from the audience? Again, thank you very much for listening. My name is Azobi. Thank you very much.